Well, hello everyone. I'm Dr. Laura Fenimore, and I am here with Dawn Pajerski. Dawn is one of our former graduates from our DNP program focused on the role of the clinical nurse specialist. And so Dawn will give us a little background on how she got to this point in her career, why she chose an opportunity to learn about the role of the clinical nurse specialist and how that education has helped her in the role that she is in currently as well. So without further ado, let me invite Dawn to join us. And Dawn, tell us a little bit about your current role and a little bit about you and how you came to this role.
Hi, thank you for having me. I am currently an assistant professor at the University of Pittsburgh, and I started just this fall. So it just started in September this year as a clinical instructor for the traditional juniors. And also I am assisting in the skills lab. And part of my role is also grading some of the advanced BSN program juniors as well. So I am very happy to be a part of the University of Pittsburgh. I graduated from the DNP program, Clinical Nurse Specialist track, just this April of 2020, and was lucky to be hired on as a full-time faculty this fall.
Great. So what's a clinical nurse specialist and what do they do?
Sure. So a clinical nurse specialist is an advanced practice registered nurse, and Pennsylvania is one of the states that doesn't necessarily recognize, at least in our part of Western Pennsylvania, a clinical nurse specialist as an advanced practice registered nurse. So I've been working as a registered nurse for 22 years, and over the last 10, I've really been working in the role of a clinical nurse specialist without the degree. And what that means is I have been working with staff to help support their professional development through different projects. Working with the organization in sitting on committees and program development, and also working with patients. For example, I was in home care and I was a specialty clinician, and I went out on special visits with patients with higher needs and would educate staff, patients, and family members in their disease process and so forth. So really working in those three areas of need, the clinical nurse specialist focuses on the staff, the system, and the patient.
So is it possible to be a clinical nurse specialist without having a DNP?
It is. So a graduate degree, whether it be master's degree or a DNP degree, as long as you're certified as a clinical nurse specialist. So I did have a master's degree, but my degree was in administration. So I decided that I wanted to get certified in adult gerontology, and decided to go back to school at the University of Pittsburgh because they were one of few that actually have a CNS program, but I needed additional clinical hours. So my master's degree didn't offer me that opportunity to be certified because I needed additional clinical hours. So I chose the University of Pittsburgh because it's local to me. Also, it's affiliated with the organization that I worked at the time, UPMC, and I was able to do my training and also work during my education and get all my experience in those hospitals that I worked for.
Sounds very interesting, and it makes a lot of sense. You know, I know in all of our doctoral programs, students are involved in doing a scholarly project. So what was your project about?
My project was titled Reducing Urinary Catheter Associated Urinary Tract Associated Infections. Sorry about that, CAUTIs. And it was done in an acute care hospital, a hospital that I didn't actually work with prior, so I didn't know the staff or the patient population. So we did reduce their urinary tract infections it went from a rate of 16 down to 0 in the 6 months that we worked on the project. So it was a really meaningful project, and it really helped me as a student learn the quality improvement process, and also professionally learn how to be a little bit more assertive and independent, being that I had to basically present myself to a group of people that didn't know me and
Mhm.
work towards a project that they had, really a need for and that was meaningful for them.
So, the folks who are listening to these little interviews are first year students, and they haven't not had a lot of experience. So, what did you do in a project to help infection rates get from 16 to 0?
So we started initially with a meeting. I had called up the organization and asked if they had a project that they would not mind having a graduate student work with them.
Mhm.
Then I met with the unit clinician, which is their second level to their unit manager. And we talked about their projects on their unit and what their unit was trying to accomplish. And they had the second highest level of urinary tract infections by the catheter, by the Foley catheter
Mm.
in the whole hospital. And they had the highest level of catheter associated urinary tract infections across all of their rehab units. So they had a real need to reduce their infections. So that's how we decided on the project itself.
Mhm. And was there something that was happening, either the staff were doing or weren't doing, that was kind of contributing to those infections?
Yes, so there's best practices, and the hospital itself has a best practice guide that the unit was not using. So they
Mm.
have at their fingertips a best practice guide that follows best practices to reduce infections, but the staff was not aware of it. So I introduced that best practice guide to them and educated the staff in regards to all the steps to reduce the infection. And we were able to implement some of those strategies to help reduce the infection rate. And so it was really their education. They had a knowledge deficit.
Mm. So it sounds like what a clinical nurse specialist can bring the best evidence, the best practices to the attention of the staff. But then again, if they don't know about it, then they're not likely to use it. But sometimes even when they know about it, it becomes a little difficult to use. So talk a little bit about how a clinical nurse specialist can help change things within a system that allow nurses to really do the right thing.
So a clinical nurse specialist can help project development, sitting on boards, whether it be committee or leading a quality improvement project like I did.
Mm-hmm.
Clinical nurse specialist can be a manager, can develop an orientation development program for new hires. In the university setting, a clinical nurse specialist can be an instructor like myself, a professor as well, and develop programs and sit on boards also within the university.
So it sounds like there's a lot of flexibility within the role. You mentioned about certification for as a clinical nurse specialist. Were you certified in a particular population of patients or people versus a disease? How's that work in the CNS certification world?
Okay. So the CNS can be certified in a specialty area. So my degree is in adult gerontology.
Mm.
So my certification exam is coming up later this year. So that will be the focus that I'm going towards, adult gerontology. But there are other focus areas such as mental health and also in settings. So there would be an acute care clinical nurse specialist versus a primary practice. So
Mm-hmm.
both in disease setting and also in the practice setting.
Mm-hmm. And have you observed within hospitals that hospitals tend to have a role called a clinical nurse specialist? Like, could I go to a hospital and look up in their job listing? Would I see one for a clinical nurse specialist? How does that work?
There are some hospitals that do have the actual role as a CNS, such as in Philadelphia,
Mm-hmm.
they have a CNS. The Veterans Administration has a CNS role where they actually do practice as an advanced practice registered nurse.
Mm-hmm.
But in our local hospitals, you will not typically see the CNS role.
Mm-hmm.
They are usually programmatic or advanced practice, not necessarily advanced practice, or advanced education specialist, something to that effect.
Mm-hmm.
So their title is not necessarily clinical nurse specialist, but that is really the role for the clinical nurse specialist.
Mm-hmm. Yeah, that's my experience as well. But certainly the preparation as a clinical nurse specialist allows a lot of flexibility from what you've mentioned and talked about. So you've gone down the road of an academic educator as a clinical nurse specialist. Tell us what a typical really good day looks like for you.
Well, for me, I'm currently a couple of days a week in the clinical setting with my traditional junior students. So we arrive on the floor in the morning, and everybody's very excited to get started with our patients. The students come in, they get report from their nursing staff, and then they, go ahead and review their patient needs, and we work together, student and instructor, and caring for the patient needs that day, whether it's assessing the patient, providing medications, doing procedures, dressing care, helping the patient get prepared for tests and things like that. So the day goes very quickly, and it's very exciting because the student nurses are very excited to be doing hands-on care with their patient and also learning as they're going, because they're working side by side with not just the registered nurse on the floor, but also their clinical instructor who's helping them gain the confidence in their skills and knowledge.
That support role is just
Yes.
so very key. I'm sure you can remember, and I can remember like it was yesterday, some of my favorite clinical instructors. And I have to say, they made me the nurse that I am today in terms of my background. And that's a heavy responsibility, right? To
Yes.
have on your shoulders, to think you're preparing future generations of nurses who may care for you or your loved ones.
Correct.
So I think that's an important task, and certainly something that I think about oftentimes as an educator. And I certainly remember that in a clinical education kind of role as a clinical nurse specialist like yourself. My master's was as a clinical nurse specialist within oncology. Back in the day,
Okay.
that was more of the emphasis at that time. So what piece of advice would you offer to a student who's thinking about this role of a clinical nurse specialist that allows a lot of flexibility in terms of different kinds of roles or positions that you might have within healthcare?
I really think that and feel strongly that all nursing students should really have an open mind about where you want to focus as your life career in nursing, because we have a lot of flexibility as a nurse. We can go into inpatient, outpatient, home care, like I said, office settings, acute care, critical care, um, you know, procedural units, things like that. So get some basic experience. Look at the American Nurses Credentialing Center website and look at their guidelines for the advanced practice roles to be certified before you choose, what certification you want. It really helps guide you in the direction of what your criteria would be to meet to be certified in one of those areas. But I really feel that for myself, after working for 22 years as a nurse, it really helped guide me to want to be the clinical nurse specialist as a certified role. In some states you can practice as a CNS and be a provider, but Pennsylvania, for the most part, in our area at least, isn't allowing us to do that. But we are able to do that in other states. So it gives you a little bit more flexibility that if you were to move to another state, you could actually act as a provider in the CNS role. So we have a lot of flexibility with a CNS degree versus another advanced practice specialty. You are kind of just focused on one area potentially in another advanced practice role.
Mm-hmm. Excellent. So what are you most proud of in the roles that you've had as a CNS, even prior to completing your DNP? What's the maybe the activity or project that you were involved with that you're most proud of?
Well, I have to say that the project that I did for my DNP project, I feel really strong about because we were able to reduce infection rates. So not only did I make an impact for the staff and improving their knowledge deficit and their practice, we also made a really big impact on patient outcomes. So I affected through that program or that project, the staff, the patient, and the organization, because we were able to improve their patient outcomes and their financial bottom line by reducing the cost related to infections.
That's terrific. You know, I think when people come to nursing, even our first year students, when I ask them, you know, why nursing, the answer almost always is because I want to make a difference. And I think that the clinical nurse specialist role clearly has an opportunity to help create change, and that CNSs really understand how to get change done within our healthcare settings. And I hope that some of our students will consider the clinical nurse specialist opportunities that we have here at Pitt to educate future clinical nurse specialists, and that they have an opportunity to perhaps shadow a CNS in that role. We're very grateful to you, Dawn, for sharing your story, and we wish you the very best of luck in your role as an instructor. And I know that your students are going to benefit from your wealth of experience as well as your education. So thank you so
Thank
very
you.
much.
Thank you very much.
You're welcome.